57-year-old George Fungo has been undergoing home care for over 14 days. He's being tested before he can reintegrate with his household.
Some patients don't like this supply because the way it is scaring. So it is our mandate to first explain to them why do we have to put on like this.
When the results came, 3 of us who tested positive. So I came back in the evening, I talked to my people, I told them what had happened, and I isolated the room for myself.
He's one of the many Ugandans being treated at home for COVID-19 as public hospitals are overwhelmed.
If you are disciplined, it is really helpful. It is working. Because I wouldn't imagine that stress of being confined in a hospital.
Fungo tested positive at Mulago National Referral Hospital and received his results via email over a fortnight ago. There has been no follow-up on him, and so, through a personal initiative, he sought the help of his friend, Kennedy Charles, who heads the 15-member KCCA Kawempe Division COVID-19 surveillance team.
After getting the results, there is nobody from Mulago who called me that you are positive, maybe you are supposed to do this. I thought the moment you got the results, it would have been the medical team to take over. They call you, even if it is possible, they ask you where they can find you, so that they give you the professional advice. Because you can see now everybody is treating based on this information which you are getting in WhatsApp.
Kennedy, who should ordinarily be in his office coordinating his team, has to be involved in the field as the cases in need of care and follow-up are increasingly overwhelming.
How are you feeling now?
At a personal level, he lost his mother to COVID-19 in this second wave and has seen some of his care receivers die in his arms.
The cases compared to the wave 1, the cases now are many. We need a team of the surveillance officer, of the clinical officer, clinician, and the laboratory person who would be able to help taking off the samples. And then we also need a person on the psychosocial support to give the reassurance of these people that COVID is not a death sentence. Because sometimes when you tell these people that we are taking the COVID treatment unit, they tend to refuse that I'm going to die from there.
In some of the cases where their conditions worsen, they can't find placement in overwhelmed public treatment facilities, yet still they cannot afford private facilities.
And those are the challenges that we make where we lose the lives of our people. But the good thing, the majority are those that are recovering.
When we try to search for some of the other members on Kawempe Division COVID-19 surveillance teams, we realize they abandoned work because of delayed risk allowances. Such voluntary health workers earn 80,000 per day as risk allowance.
That one, of course, has affected the surveillance activities. There are very few people who can decide to continue working even when the facilitation is, of course, comes late. It comes, but it comes late, and that one has greatly affected.
Both Kennedy and Fungo believe COVID-19 fatalities can be reduced if hospitals and surveillance teams are empowered before the country reaches the peak of infections, which the ministry projects for late this month and early August.
It can help greatly so that the people can access testing services freely and easily, so that they are detected much earlier, they are put on treatment, and then the follow-up. But the way I'm seeing the situation now, if the cases continue going up, then we have to sit at the drawing board.
If they can employ people to go and work within 5 months, and just a temporary appointment, they will be able to finish this. And it happened not here in Uganda, everywhere.
On Friday, Health Minister Dr. Jane Ruth Aceng mentioned them among government's priorities during the lockdown.
The Ministry of Health intends to maximize the opportunity to do the following: streamline and strengthen home-based care for COVID-19 mild and moderate cases. Increase the capacity of our health facilities to optimally manage COVID-19 cases.
But for Kennedy and Fungo, it's how fast can the words and paper plans be implemented to save the population. Muhumuza, NTV.